Normally we see some people or some people know about scaling of teeth, some people doesn't know about it, and why oral scaling is necessary and how often it should be done.
So regular dental checkup on yearly basis would be once in an year or once in 6 months to a dentist to check whether there are any other sorts of problems in the mouth, or whether if general checkup is required along with simple scaling what you have mentioned, which is also known as cleaning in day-to-day terminology.
Right.
So what does scaling mean and how it is performed? So scaling is nothing but removing of the attached debris or the attached waste particles or food particles onto the tooth structure, which are not being able to be removed by your toothbrushing or floss or any other sorts of mechanical household aid. So in that case, there is some equipment which cause vibrations onto the material and try to detach it from the tooth. So that is called a simple scaling. So once in 6 months to 1 year, if you get checkup performed and also get the scaling performed if it is required, it will be good onto day-to-day basis of the patient. One more thing, there is always a myth, like if we get scaling done,
Enamel will be removed.
enamel will be removed. That again depends upon the condition of the tooth and the thickness of the enamel and how is the procedure performed. So all these factors, it's not a single factor which can be concluded that this is a problem which might lead to anything. For example, now if a patient has some amount of fluorosis condition where the teeth is very brittle and the enamel is very brittle. So in such conditions, there might be crumbling of the tooth when we perform such a procedure. So seeing the teeth condition, if you are going to a proper expert, he will decide and tell you what to do and how to go along with the procedure. That can be more helpful to the patient.
Okay, so the take home message is, once in every 6 months or once in 1 year, go to a dentist for general checkup. Based on that, the dentist will decide whether to do scaling at that point or
Yes.
not, and what type of scaling needs to be done. Maybe I assume there are different types of scaling.
Yeah, there are different types of scalings.
Yeah, and the dentist or expert will decide what to do at that point in time.
Yes.
Thank you, Krishna.